Well, there are new study results from Johnson & Johnson, and they suggest that a second dose of its COVID-19 vaccine generates as much protection as the two-dose vaccines from Pfizer and Moderna.
So here tonight to answer your questions is Dr. Todd Ellerin. He's the Chief of Infectious Diseases at South Shore Health. Dr. T, it's great to see you as always. More than 300,000 people here in Massachusetts have received the one-shot J&J. So a couple of questions here. What do you want them to know about the benefit of that second shot, and how soon could they get it?
Eddie, the two-dose series with J&J looks really good. For those who are thinking that they got the short end of the stick with J&J, that is absolutely not true. When you look at the phase 3 trial, 30,000 patients in the United States, effectiveness against preventing severe infection, 94%. 94%. Against critical cases, severe and critical, there were 0 cases. Wow. So it looks really good. Wow. And we know that that second dose really boosts the immune system and is really protecting against infection.
When do you think, Dr. T? 30 days, 60 days, 2 weeks? Do you have an idea?
I think the Moderna booster is going to go next, okay, from the FDA. Remember, the FDA is going to have a really busy month ahead, next couple of months. Dr. Fauci said within several weeks, so we'll see how that goes.
Doctor, nice to see you. Thank you for joining us as always. The studies looked also at the wait time between the doses. So why is that important? Why is that spacing important?
It's really interesting, Maria. What they showed was that the increase in immunity at 2 months basically was about 3 to 4-fold. So that's very, very good.
Right.
But then what we learned is when the boost is after 6 months, you actually showed a 12-fold increase. So if you do that longer interval between the 2 doses, you actually get even that much more robust immune response.
Interesting.
The J&J vaccine is the only one that's offered here in the United States as a single dose. So why do you think it took so long for the company to discover, hey, 2 doses actually offer more protection?
Right. Eddie, remember, the Ensemble 1, which was the single dose, started in September. So this Ensemble 2, the 2-dose, started 2 months later, right? And remember, they also had to, at that point, they were really robustly recruiting the single dose because they were trying to save lives. So that sort of got preferential enrollment. And then the other point is that patients that already completed the study in the placebo group, they were getting the actual vaccine in February. So it was a more complicated study. But let's face it, J&J took a lot of courage to set up 2 huge trials, single dose versus the 2-dose. So it's complicated, but they've done it.
All right. Some people who've received the Johnson & Johnson vaccine have told us that they would like to get a second shot, but not from Johnson & Johnson, from a different manufacturer. So what is your advice as an infectious disease specialist?
Okay, the first advice I would say is take a deep breath and let's wait to see what the FDA and CDC say about this. But the second thing is, I want them to know that there's actually a large trial that we haven't talked much about in South Africa that enrolled 500,000 healthcare workers, many of them young women. There were only 2 cases of that vaccine-induced clotting that we've heard so much about. So overall, the benefits far outweigh the risks. But I will say this. Internationally, if you start with an adenoviral vector vaccine like AstraZeneca, similar to J&J, and then follow it up with an mRNA vaccine, you really do get a very strong boost. So I think that may come soon enough.
Interesting answer. Okay, great. Dr. Todd Ellerin from South Shore Health. Thank you, doctor. We appreciate your time, as always.
You bet.
Great to see you, Dr. T.
Well.
Thank you.